You've been a contributing factor to the success of our organization for a very long time, and you've seen the good times, you've seen some challenging times, kind of like during the pandemic, where we've seen the very best come out of our membership. What do you consider to be the greatest threat facing the future of optometry? And how do you see the industry responding to that threat?
Apathy. My biggest concern for our younger doctors is assuming that it's just the way it is because it always has been, and not realizing that uh, it is a legislated profession, and therefore we have to be on our toes. We have to be aware because there is always a wolf at the door that wants to take it away. And it's not just in one aspect of it, it's in every aspect of our field. I mean, there are opticians that want to take away the glasses part of our field. There are medical doctors that want to take away the medicine part. There are teachers who want to take away the vision therapy portion. Occupational therapists would like to take that away. And then you have industry. If you've noticed that virtual reality, what is more about eyesight than virtual reality? Eyesight and the understanding of how the body functions and its coordination, total body coordination as your eyesight controls all of that mechanism. But there are other people in psychology and in technology, in um, all sorts of fields that are nipping away at our field. And we need to be aware that attrition can happen, and it can happen slowly and insidiously. So you've got to be on your toes. Otherwise, it can be taken away. We took some of it away from ophthalmology. Somebody else can take it away from us.
Apathy is the greatest threat to the profession. So, with that in mind, what final words of wisdom would you like to impart upon young students and young ODs just beginning their profession?
Don't be afraid to be aggressive. Don't settle for mediocrity. Don't settle for a practice that doesn't meet the aspirations that you have. If you embrace the full scope of optometry, and I will add that a lot of times that full scope is only appreciated and um, realized if you live in rural communities. Don't be afraid to move to a rural community because in those communities you're it. You're number one. You're the eye guy. It doesn't matter what comes up. If it has anything to do with eyesight or eyes, they come to you first. In the cities, they self refer to everybody, and there's no loyalty. So, the most rewarding practices that I've observed over the years, both financially as well as just gratifying in terms of serving your public, have been in more rural communities. So, I would recommend that you give that some serious thought. But wherever you're at, don't be afraid to embrace all of it. Don't let yourself just become spinning the dials and doing some just standard eyeglasses program. Reach for the big stuff, the cool stuff, because that's what's fun. I can tell you some of the things that I've managed in my practice are just so rewarding. The things that I've been able to diagnose and the things that I've been able to treat in these years. That's part of the reason after 50 years I still love to show up to my office because it's fun. Every day it's a challenge. Every day is fun. Plus, I get to see all my old friends. One of the benefits of a small community is you get to know them really well. And we kind of protect ourselves as old friends because we know everything about each other. But it's a great experience. Optometry has so much to offer. It's the best kept secret in healthcare.
Thank you again for bringing all of your knowledge and experience and expertise to the conversation. We've covered a lot of ground. Is there anything that we haven't covered today?
The time that I spent on the AOA board was incredibly rewarding because in that I took what I had learned in Oregon and was able to pass that on at a national level. So after Oregon had passed our DPA bill or diagnostics bill, Virgil Rhodes, who was from Kentucky, we split up the nation and we each tackled 23 states and went out and helped each of those states pass their laws because it had to be done one-on-one, one state at a time. And also work with, on a national level with Medicare and trying to get reimbursement so that when we were able to do these various procedures that we could be reimbursed through the same mechanisms that all the insurances and all of the federal and state agencies were in charge of. So it wasn't just passing the laws, we had to be able to get paid for these things that we could do. So that was a big challenge that took a long time. And even though I said that the diagnostics part had mostly to do with the beginning, there was a continual processes that needed to proceed. Next came how to get paid or how to provide therapeutic agents, so antibiotics and steroids and all of the various medications that are out there. And so ultimately today, optometrists can prescribe any medicine for anything, which is rightfully so. We've had the training in pharmacology. It's not like we didn't know then or don't know now. We know how to treat stuff and we know what things we're good at using and we know where our limitations are. One of the things that have been so fortunate because of that collaboration we've all had over the years is awareness that if we mess up, it hurts all of us. And so today we have the lowest malpractice insurance rates of any health profession, in spite of the fact we can prescribe everything. So we're very aware of that. What got us here was being able to learn how this process works. And it made us, I think most of us realize what a wonderful process it is. And not just in optometry, but on the entire process of how the United States works. And it takes people's natural tendency to be self-serving and selfish and even sometimes dishonest. And the system actually works. And in the end, mostly good stuff comes out. I mean, if there's one thing I've learned is that you can fix things and people do fix things. And so when whether it's in optometry or any field, as you work through those problems, we have laws and statutes that are voted on. We have regulations that sometimes are put in place by people who maybe shouldn't. We have policies. We have even ethics that aren't even necessarily right. But All of those things through the legislative system slowly work their way through, and slowly but surely, good stuff comes out of it.
Dr. Rush, on behalf of the Oregon Optometric Physicians Association and our 700 plus members, thank you for taking the time to talk about your very enriching background, and thank you for your contributions on both the state, national, and the international stage. You're a remarkable man, and thank you very much for all that you do for the field of optometry.
My pleasure. Thank you.